Well, hello, everyone, and welcome to this new edition of News You Can Use. I'm your host, Thera Martin. So glad to have you with us. Oh, the holiday season is swirling all around us. And by the time you see this show, heck, the holidays might be almost over, but that's all good. We've got some great information we're going to share on the program today. In our first segment, we're going to be joined by Dr. Denise Wynne Baker. She is a pediatrician extraordinaire, and she will talk to us about what we can do to make sure our children and our babies are healthy. She also mentors young people who have dreams and visions of becoming medical doctors. And she does that through an organization, Medical Society of Eastern Pennsylvania. So she'll tell us about that as well. When we turn the page a little bit later on in the program, guess who's going to join us? Pennsylvania State Senator Sharif Street. He's going to talk about how this year of 2025 ended up, politically speaking, and for the state of Pennsylvania, our highs and our lows, our glows and our grows, if you will. So stay along with us for the ride. News you can use. It will start in just a moment. Glad to be here, Thera Martin, with you on this edition of News You Can Use.
Very much for having me.
Wow.
Good to see you.
It is don't want to see you, but you didn't say that. You said you can use Rebooted. I'm Thera Martin, and I am glad to be back at LaSalle TV. So now our program officially begins. Dr. Denise Wynne Baker is here. She's an extraordinary pediatrician. She's a committed Pennsylvanian who gives back whenever and wherever she can. She is a leader in her own right. And she's also going to be representing today on behalf of the Medical Society of Eastern Pennsylvania. So thank you for joining us, Dr. Denise Wynne Baker. Good to see you.
Great to see you also. And thank you so much for having me, Thera.
Yes, yes, yes. Let's start out talking about some health tips, if you would, for parents and grandparents and other caretakers of our little children and the babies. What do we need to be doing to make sure that our children are as healthy as they can be during this winter season we're getting ready to jump into?
Yes. Well, you know what? I'm going to jump in and address the elephant in the room. Immunizations. They're very important. Immunizations, vaccines have been around for 200 years. It started out with smallpox, and I'm sure a lot of people still have that little scar on their arm from smallpox that they gave out. The last dose was in 1972. But immunizations are very important. It prevents you from getting all those serious consequences and illnesses from diseases and viruses. It's like an armor. It's a protective armor. So if you ever come into contact with any of these bacteria or viruses, your body can defend itself. So those are really important. And, you can talk to your pediatrician about it on any of your concerns, but that helps us to prevent diseases.
Plus, there are laws around immunizations too, right, doctor? I mean, you can't just put your child in kindergarten if they don't have any immunizations unless there's some special considerations that have to be followed, some religious beliefs or something like that?
That's correct. And the school district has been very helpful in that they flag students who aren't immunized and, they bring it to our attention and we give them the immunizations. So, that's has been a godsend.
Yes, yes. Now, I know that people in my age group, oh, I go get my flu shot every year. Like, here's my arm, okay? Do we have flu shots for children, or how do we help the children try to avoid the flu?
Yes, we do have flu shots for them starting at age 6 months,
I do.
and it's dose dependent. So the smaller, younger kids receive a smaller dose than the adults or the, elderly. So yeah, we have flu shots for them, all the immunizations. Yes.
Okay. Okay. So that is done. And then there's just some regular good sense kind of things, how we eat, what we're putting in our children's bodies, as well as what we're putting in our own bodies. So fruits, vegetables.
Yes. Nutrition. Excellent. Fruits, vegetables, your proteins, all of this helps to develop your immune system and it gives a boost to your immune system. Let's just talk about a few things. Milk. Okay. Milk, it has calcium in it. It has protein in it. Babies up until the age of 1 year, give them your formula or the breast milk. Okay. From 1 to 2 years of age, and this gets some people are a little confused about this. 1 to 2 years of age, they should have whole milk. They need that extra fat for brain development. They need that calcium, that vitamin D. Okay. So, those things are very, very important. milk, fruit, vegetables, proteins.
Okay, so we will keep that in mind. So now, oat milk, um, things like that. I never heard of that when I was a kid coming up. We didn't have that in our house. My parents didn't service that. But is oat milk as good as whole milk, or parents need to look at that?
Yeah, that's a great question. And oat milk, we call it plant-based milk versus cow's milk.
Yeah.
And it's after a certain age, like after 2 years old, it's a preference. Okay. So as far as whole milk or cow's milk, let's say cow's milk, it has
Hmm.
like a lot of nutrients. It has the calcium, it's fortified with vitamin D, something that the plant-based milk does not have. It all has to be
Hmm.
fortified. We're trying to avoid as much as possible with people putting things
Yes.
into something to fortify it. So you
Yes.
have to look at those things, you know what I mean? So it is at a certain point, some people have allergies to lactose and they need that plant-based milk. But in general, it's cow's milk is fortified
Okay.
and it's
Okay.
nutritious and has a lot of protein.
Very good. We'll keep that in mind. And I hope that our viewing audience is taking notes as we're talking with Dr. Denise Wynne Baker today on News You Can Use. The other thing, um, when I was coming up, little girl, we were taught when you sneeze, you cover your mouth with your hand, cover your mouth with your hand. And then I don't know when it was, 10 years or so ago, suddenly we were like, you're just making it easier to pass germs. You put your hand over your mouth, then you go shake somebody's hand. So that's when we started saying, sneeze into your elbow. Is that working?
Yeah, that is so true because a lot of the viruses are airborne. You spread it through the air.
Mhm.
So, I do recommend that, and I tell my patients, my kids, that to use the Dracula method, I just say, and then cough or sneeze in your elbow. And make sure you wash your hands afterwards because that's
Yes.
important. So yeah,
Yes.
you're absolutely right.
Mhm. So washing your hands games. So these daycare centers and nurseries and kindergartens where you got all the little ones, the teachers, the instructors, they need to come up with, and I'm sure they already have the games that they can play and the songs that you can sing about washing your hands. Because children, I mean, they're innocent. They don't know that they're carrying germs and that they're passing it on to their next little playmate if you don't do certain things properly, like keeping those hands clean.
Yes, and kids love to play in water. So you can make it a game. If you sing the happy birthday song twice, that's like about 2 minutes of washing your hands. And that's what we really encourage. Make it really bubbly and have them wash their hands and play in that water.
Okay.
And wipe down the surfaces, wipe down the doorknobs, the
Hmm.
light switches. All of
Hmm.
those things help to prevent, illnesses and diseases from
Absolutely.
spreading.
Okay. And then the other thing we wanted to talk to you about that's so important. We see when I look at the numbers and the statistics around African American medical doctors, um, they're still not the numbers that I would like to see. And I'm always meeting young people who tell me, I want to be a doctor. I want to go to school to be a doctor. And I mean, I can't track everybody that I talk to who says that, but I just want people to understand that there are opportunities. And if the first door medical school doesn't open for you, don't give up on your dream. Keep trying, right?
Yes, yes. And that's where mentors come into play,
Mhm.
because the medical practice, physicians, it's a wonderful career, and you're helping people.
Mhm.
So the what main focus for the Medical Society of Eastern Pennsylvania at this point is to increase the number of Black physicians. We want to increase the number of doctors that look like us and they will
Mhm.
help us.
Yes.
Statistics have shown that when we are treated by people of the same culture or people that look like ourselves, we have more of a tendency to believe in what they're saying, to follow their orders, and just to be healthier. So
Mhm.
that's really important, and that's essentially what we do. And Thera, you have to start early.
Mhm.
That's why mentors are so important. And I try to emphasize that. Why reinvent the wheel? I
Mhm.
mean, I'm a physician. We have physicians out there, not as many Black physicians as we need, but we can mentor so we can tell students. And part of our program, we start in high school. We're starting in
Mhm.
high school, telling
Mhm.
them what they need so they can have a plan. You need a plan.
Mhm.
That
Mhm.
helps.
Yes. Absolutely. And then, so the Medical Society of Eastern Pennsylvania, you all offer some workshops or workshop series, or how do you put young people together with you experts to help them pass that MCAT exam?
Yes, yes, that's very important because the MCAT, the medical college admissions test, that is that big hurdle that you have to do well to
Hmm.
get into med school. So we start with having them understand that they do know the material. We try to help increase their self-esteem. We give them
Yes.
a whole program of questions from UWorld Question Bank, a prep course, if you will.
Okay.
And we have them go through the questions. We talk about it. We teach them how to effectively answer the questions, because one section is critical analysis and reasoning. Okay.
Mhm.
That's just like the SATs. That section where it was so boring that you could barely get through it. So
Hmm.
method to get through that. So we teach them
Hmm.
all of those things, and we give them full length exams in person.
Hmm.
So we reenact the actual
Excellent.
MCAT exam,
Get
and
them
we
ready.
help. Yeah, and it's a 6 month program because it takes
Mhm.
time to prepare for this exam. So we want them to be competitive with their
Mhm.
scores.
So, how can young people who are watching this show, the grandmoms have them watching news you can use, how can they be in touch with Medical Society of Eastern Pennsylvania to find out about when these courses are?
Yes, yes, they can contact us. They can go to our website. That information will be there. We
Mhm.
usually start the application process around August, September. We start the course in October. You have to have completed your undergraduate degree, or in
Yes.
in the process of completing it, you should have
Mhm.
taken all of those exams, those courses, those science courses, which if you're a bio major, pre-med major, nursing major, psych major, you more than likely have. So,
Mhm. Okay.
they can just contact us and we can take it from there.
Now, is your website blackdoctorsphiladelphia.org?
Yes.
Okay. Blackdoctorsphiladelphia.org. That's how you can get to the Medical Society of Eastern Pennsylvania and learn more about the wonderful, wonderful programming that they have. And we have already missed the Legacy and Liberty Masquerade Ball for 2025. That has happened by the time people see this show. But congratulations on a wonderful event and fundraiser for Medical Society of Eastern Pennsylvania. And everybody who is interested in supporting this organization, stay plugged into them. Keep checking out their website, and you'll know when their event is for 2026 when they do another gala.
Absolutely. It was fabulous. It was wonderful. We have
Mhm.
the medical professionals there. We have the
Yes.
different sponsors there. We have medical students, residents, everyone just mingling. You might even run into your
Yep.
dog there partying. So
Yep.
you have to
That's
make
right.
sure that you include yourself.
Well, you are a wonderful example of Black doctors in this country. We're so proud of you and proud of you're still being humble, even though you're a big shot doctor making moves and doing all kinds of great things. You're a humble spirit. And we can tell that you care so much about what you do. So keep on doing it, Dr. Denise Wynne Baker. We appreciate you.
And I appreciate you. Thank you so much, Thera.
And that does it for this portion of our show. We're so glad that Dr. Denise Wynne Baker was able to be with us. In a moment, we're going to come back and we're going to be talking with Pennsylvania State Senator Sharif Street. Don't go away.
The challenges our planet's animals are facing sometimes feel a bit heavy.
The animals haven't eaten in a day, 2 days, they haven't drank anything, they're cold, they're dehydrated.
But remember, there's good happening right now. At home,
All right, we were able to get into your unit, and we have all 4 of your cats. So,
Okay.
and around the world for any animal, any disaster. Search ifa.org/disaster ready.
Boys Town National Hotline.
Yes, I need help with my daughter.
we are back as we continue with our program. I promised you we'd have Pennsylvania State Senator Sharif Street, and he is right where we asked him to be. I appreciate you so much, Senator Sharif, and thank you for being with us on this edition of News You Can Use.
Look, I'm glad to be on it. I'm glad to be on, and I appreciate get a chance to talk to you about all the great things that have been going on.
Now, this year of 2025 has been an extremely busy year for you and for a lot of us. Let's look back over the year and talk about some of the things that you are particularly proud of, Senator.
Well, look, I'm super proud that we were able to push back on the cuts to Medicaid and Medicare and the social services. While at the federal level, there were some dramatic cuts in Pennsylvania. Senate Republicans had proposed $2.5 billion in human services cuts. We fought against them, and we were able to get a $750 million increase in human services spending, which will take care of so many vulnerable families. I'm pleased we were able to get several $100 million. We were able to get, I think, a couple $100 million for violence prevention programs and public safety from the Commonwealth. And I'll tell you something, earlier in the year, there was a problem where 400 daycare centers weren't getting paid. And I was able to working with Representative Derisha Parker to get those daycare centers paid as well.
That is so amazing. And then there's been a lot of nonprofit organizations in the city, in your district, that benefited from your fighting for the people up there in Harrisburg to make sure that there was some funding for different kinds of nonprofit work that was being done in the city. And I know that people are appreciative of you for that. But then all the programs, like almost every week, I get something from Aisha Richardson that's talking about things that Senator Street is doing in the community or things that you were doing Harrisburg or other parts of the state.
Some of the community stuff that was really cool. We did a community baby shower where we touched all over 1,000 women. And it was not just about giving them free cribs and Pampers and all those things, we gave them valuable information that will address infant mortality and Black maternal health. And not just Black women, but Latinos, Asians, white women all came out. But we were in zip codes where there's a particularly higher levels of infant mortality, maternal mortality, and a lot of it is information we got out there. The Black Men's Health Wellness Program, over 1,000 Black men got their biometrics taken care of, including me, and it's been a health journey. I've been exercising a lot more this year and feel good about that. And I'll tell you, there are so many of us who are fathers and grandfathers. We want to make sure that we can live to be there for our families. That was a big accomplishment. And then there are fun things like we gave out this year. I ended up giving out all in over 7,000 turkeys. We had 4,400 that we gave out to over 400 different organizations, and then we worked with Allegheny West and served to probably another 1,700-1,800 people. Just in individuals that lined up to get turkeys. And then there were so many other groups that we participated with that we saw. Shout out to Saudia Schuler, who had like a whole farmer's market worth of stuff that she gave out. Representative Ahmed Brown, Representative Noah Burgos, all had really impactful events. And that was important because we were all very concerned about the food insecurity that exists. And so I was really proud of the way my colleagues and a lot of people came out to address food insecurity this year.
Now, economic development. You've got a big district, and I know that North Philadelphia is not the only part of your district, and Allegheny West is not the only part of your district, but that's where I know the most about the work that you do. And so we look at Allegheny West Plaza. We look at a new building that's coming up, a new Cortland at 3030 North 20th Street. Yes. So we can have all these ideas that we want to have, and we can get architects to give us renderings and what have you, but we got to have important people behind us to make it happen. We need state funding. We need city funding, as well as some private funding to make some of these economic development projects happen. Thank you, Senator. You fought for us so that we could have that new recreation center. You fought for us for that Allegheny West Plaza building for senior citizens and the new one that is still being built, New Cortland. And so we appreciate that you understand the importance of moving our communities forward so that old communities like an Allegheny West area can be revived.
Yeah, I know it's important. And one of the things I want to point out, sometimes people say, why can't y'all work together? Well, in the Allegheny West area, Councilwoman Cindy Bass and I walk hand in hand. There
Mhm.
is city money and state money. We got a new school built with Pierce Elementary School. We've got renovations at the plaza. We've got the rec center getting developed. There is so much good work, and we are working city and state hand in hand, getting those things together. And look, it's an example, and community people engaged. Allegheny West CDC has done great work. I just mentioned handing out turkeys, but it's also, you're right, getting schools built, getting plaza, getting rec centers built, making sure that there's an impact for each of those individual businesses. And so look, we're really proud of the work that we're doing there. And sometimes people say, what are you about? Development? What are you about? Public safety? We're doing all of it. And there are other issues that are on big policy issues, like we're moving forward on cannabis legalization.
Yes.
It's important. Black and brown people are still four to six times more likely to have a law enforcement encounter, even though we're not jailing people. Those encounters are still adverse, and we're looking to legalize cannabis statewide. I've got legislation now I support on all four caucuses to move forward, and the governor. So I think we're going to get that done as well in the coming year. And that will be impactful to so many people. I never smoked cannabis in my life, but I'll tell you what, I don't think that kids in the community should be getting records for doing it. I don't think that senior citizens who want to use it should get records for doing it, and it's limiting people's job opportunities. And so we're moving forward in that space as well.
When I think about your late uncle, the former state senator Milton Street, he was ahead of his time because he was talking about legalization of cannabis years and years ago. And here
Yeah,
you are making it happen.
yeah, you're right. My uncle, the late great Senator Milton Street, was the first state legislator in the modern history of America to propose cannabis legalization, and I'm pleased and proud to continue working to get that work done. And now, unlike in his day, where the Senator Street has not an ounce of support, today we have broad space support. Over 70%, 75% of Democrats and Republicans, rural and urban, support cannabis legalization. We have support in all four caucuses, and we are going to get this done.
Now, the year 2025 also made a big decision time for you in reference to your position as the chairman of the Democratic State Committee. And I loved the idea of Senator Sharif Street being the head of the Pennsylvania State Democrats. And correct me if I'm wrong, you're the first African American who's ever had that particular position?
Yeah, I was the first African American to be vice chair of the state party and the first African American to be chair. And I want to talk about that a little bit. Look, during when I got involved in the leadership of the state party, Democrats only had 16 out of 50 state Senate seats, and now we're only 2 seats away from taking the majority. When I got involved, the Democrats in the House were down over 20 seats in the state House, and now we have the majority in the state House. We had never held the governor's office three consecutive terms, and now we have the governor's office. And we only had 5 seats in the five of our congressional delegation seats, and now we're at 7. So we have made progress in every way and in every level since then, and proud of that work we've done. Oh, and judicial, we swept the entire time I was in the leadership of the state party. We swept every judicial seat and broke fundraising records. So I'm proud of the work we've done in that space. I have moved on to run for Congress and thought that we should.
That's the only reason you had to give up the seat, right? Because there were people.
Yeah,
like,
no, my term wasn't
give
even
up that
over, and
seat.
I was pretty popular. There were a lot of people that want me to leave, but look, the FEC rules make it difficult to do both, and thought there were some real challenges in Washington that needed to be addressed. And so I wanted, just like we've been able to build coalitions to address the challenges that happen in Harrisburg, we got to build those coalitions. And that doesn't mean compromising on our values. What it means is being able to work with people from different backgrounds in order to get things done. So there may be people who I disagree with on social issues like abortion, where I believe in a woman's right to choose, and some people may not. But on another issue, we may be able to work together, like getting drug and alcohol funding to programs like One Day at a Time, where I was chairman of the board, and we're addressing people's issues. There may be somebody else who I don't agree with on an issue like gun control, but we can work with them on food insecurity. And ultimately, I have found the way to get things done in a chamber that is often divided. One of the things I'm concerned about is I helped create the Pennsylvania Healthcare Exchange. It reduced that's been using Obamacare tax credits to lower the cost of healthcare for every Pennsylvanian. Through creating the Pennsylvania Healthcare Exchange, nicknamed Penny. Those tax credits are being threatened in Washington. They're set to expire. That undermines the work I was doing in Harrisburg. We need to address that. Things like chronic illnesses like diabetes and hypertension. We need to be able to use Medicaid dollars responsibly to address those kind of chronic problems, even if that means getting fresh fruits and vegetables into people's homes. And so there's a lot that we need to do. And then finally, the issue of gun violence has touched so many in our community. My staff, Brother Henry, my district director, lost a grandchild. Lisa had a daughter murdered. Rashawn lost a spouse. I've had so many people around me. We had bullets go through one of my district offices. And on July 4th, 2021, we lost Lala on a mass shooting in West Philly. So the issue that we need to pass an assault weapons ban is so important to me at the federal level. I've sponsored legislation here, but it needs to be statewide. Guy got in his car in Vegas and started driving across the country, and then got out in New York and started shooting people. He weren't even the people he was mad at. Not that it ever be justified.
Right.
We need to. You can't stop all of killings with assault weapons ban, but 108 shots were fired in a minute, or in about a minute, in the mass shooting that Lala died in. The cops were on the scene, but you can't do anything if you can get off 105 shots in less than a minute. People are going to die. And so we need to deal with that. And at the state level, I'm proud that we've been able to advance money for violence prevention programs and first responders. We even got money for Bilal and Father's Day Rally Committee to have a mobile trauma unit.
I've seen it.
From place to place, talking about trauma and stopping, because a lot of times hurt people, and they want to. But we've got to address the issues of gun violence, and we need to do it for the whole country. And so I'm proud to be a candidate for Congress. I will tell you, and look, I'm probably a little more religious than some people, but there was a scripture in the book of Jonah where there were people that Jonah was comfortable where he was, and he only ended up in the belly of the big fish because God told him to get to Nineveh, and he had to go down there because there was work to be done in that powerful city. And so, look, we're going to go down to Washington and do God's work, hopefully address gun violence, protect Obamacare, make sure we can get money for people to continue to have SNAP, make sure we address food insecurity and healthcare, and build the coalitions, fighting people when we need to, but working with people when we can. Things like, to one other thing I forgot to say, the farm bill, the urban ag bill, we got it in there, like right up on Glenwood Gardens. We got Glenwood Gardens and so many farms, the farm, Hansberry Gardens, a lot of gardens have gotten money from the Urban Ag Program. And that's an example. We worked with rural folks and urban folks working together to address food insecurity. And those community gardens, people love them.
And we're going to continue addressing food insecurity as we head into this new year. Senator, thank you so much for your very valuable time. We wish you all the best as you go forward with your march towards Congress. Have a wonderful, wonderful holiday season, sir. Take care.
So much. God bless.
And that's it for this edition of News You Can Use. Everybody, we wish you a blessed, happy, and positive 2026. Take care. Bye-bye.